calculus. Now, this is an extreme case. This person looks like they haven't had a cleaning in a very, 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 very long time. So that's why he's going with the hand scaling as well as with the cavitron. Looks like he's really, really trying to get after these lingual deposits that they have there. And usually with the calculus, it usually forms a lot more on the lingual side than on the front side there. Because a lot of times people actually brush the anterior portion of your teeth or the front side of your teeth a whole lot more. But it looks like the patient actually has very, very, very large deposits on the lingual side, on the tongue side of those teeth at the bottom. All right, so this is a huge deposit here, man. Like, that is freaking huge. So calculus actually is like a form of tartar buildup. This hardened deposit actually starts to get bigger and bigger as a function of plaque. Normally, it starts with the biofilm. So like after you have your teeth cleaned, you see the dentist, they clean your teeth. There's a small biofilm that attaches to your teeth. Now, when you eat, the plaque or tartar starts to deposit onto the biofilm. And it's almost like a bunch of layers just start to keep building up, building up, building up. And then over time, the minerals that's in your mouth through your saliva and things like that starts to actually calcify fluid, and it actually turns into calculus. Let's keep watching. All right. I gotta stop right here. So you see a lot of blood, and that is pretty much a good telltale sign that one, this patient has some type of inflammation, some type of disease process that is going on here. So you're going to have a whole lot of bleeding gums just because of the deposits that have set on the teeth for long periods of time. And so the body actually starts to try and wall those things off, and it leads to a lot of the infection that's there. But also with infection, usually the bleeding is coupled with that sometimes. Let's keep watching. Now, it's also important to know that this patient was numbed up. This patient has to be numbed up in order to have this procedure done. No question about it. And I'm sure we don't see x-rays here, but I'm sure if we were to see x-rays, it's highly likely that we'll see an extreme amount of bone loss. I'm pretty sure once they start to remove this calculus here, we're going to be able to actually see that the teeth are mobile and they can wiggle a little bit. Let's keep watching. Did you see that? It actually kind of moved a little bit. So like after he had knocked off that last huge deposit there, it started kind of wiggling and moving a little bit. And that was exactly what I was talking about before. Let's keep watching. This patient's calculus is so heavy that it has started to come into or start to fold over into the patient's occlusal table. That is bananas. Wow, that is a huge change, man. You can actually see that tooth there too as well. That tooth's ready to go. It is ready to go, no question about it, man. Luckily this patient is numbed up, man, because that is definitely looking like it would be painful if they weren't numb. Night and day though, man. This is crazy. I'm ready to see the before and after. So much better. But the tissues are so angry though. But got all those deposits off, man. I agree. Go brush your teeth right now. Because you don't want that problem. Alright. It's highly likely that this doctor is probably going to remove those hopeless teeth that we talked about before, and then also put this patient on what we call a perio maintenance, meaning that they'll come in a little bit more frequently than a normal healthy patient. So they may come in every 3 months for periodontal maintenance after they complete their first round of SRPs in all of their quadrants of their mouth. Also, too, it's highly likely they're going to remove these teeth. They'll probably put them on a Peridex rinse. But based on just what I saw here, it's highly likely that they're at least going to try and get this patient back more frequently just to kind of help break up some of that disease process. Hey, you guys be blessed, man. Talk to you real soon.